Beauty comes in so many different shapes, forms, and sizes. But what we truly believe is that what is all-encompassing is that beauty is confidence, and that's within everyone's reach. Hi, and thank you for joining us for a second episode of GBDavis Plastic Surgery Podcast. I am Dr. Gabrielle B. Davis, a board-certified plastic surgeon with a practice in Beverly Hills.
Hi, I'm Ginny Yoon. I'm a pre-P student, and I have been working with Dr. Davis, accompanying her in consultations and procedures. And I hope you guys really enjoyed our first podcast. If you have any comments or any feedback regarding that, please leave it down in the comments.
So the topic of today's episode is everything you need to know about liposuction. So the American Society of Plastic Surgeons labeled liposuction as the most popular procedure in 2022.
And honestly, I'm not too surprised by that. I think liposuction is not just only in the US, but like very popular worldwide. And liposuction was a fad, it is a fad, and it will continue to be a fad because, everyone's always going to be interested in having that perfect contour.
Okay, I can
With
understand
that being said, I also understand that liposuction has so many misconceptions as well as different types of liposuction. So I hope that today we could go over all of that and just clear the air for our audience.
Okay, absolutely.
So I guess let's start with the different types of liposuction because, I walk down the streets, I see it all over the internet. You have the PAL, you have the SAL, you have the LAL, the BAL, all of that. So Dr. Davis, can you first go over what exactly they are?
Okay, well, let's start off with just basic liposuction. It is a procedure in which we use suction to remove fat. So that's suction-assisted liposuction. Now, there's different modalities that can be used with suction-assisted liposuction in theory to improve the overall outcome.
Okay.
So one of those modalities is using laser. So it's laser-assisted liposuction.
So that's the LAL.
Exactly.
Okay.
So smart lipo is an example of that. In theory, laser is supposed to help with skin tightening, but when you look at side-by-side comparisons between laser-assisted liposuction and traditional suction-assisted, there's really no difference with respect to the outcome.
Okay.
Another one is the use of ultrasound. Ultrasound helps to break down the fat, and then suction is used to remove the fat. So an example of that would be Vaser liposuction. But again, when you look at side-by-side comparison, the results are about equivalent.
Okay.
Now, Vaser or ultrasound assisted may be helpful in breaking down scar tissue. So patients that had liposuction before and they're getting revision liposuction, that's where it may be helpful.
Okay, and then there's the power assisted, which you and a lot of plastic surgeons do prefer, right?
Correct. So power assisted is basically just, again, suction assisted liposuction with vibration. So vibration is used to kind of break down the fat, and then the suction is used to remove the fat. So plastic surgeons tend to favor this because there's less work for us as the operator. Instead of being very aggressive by moving your hand back and forth to break down the fat, the vibration breaks down the fat. So it's less work for us. But again, the results are pretty much equivalent.
So I guess basically whichever modality you go with, the results are about the same.
Correct.
Liposuction is just sucking out fat. So, you could go with those like laser or ultrasound, but it's not really going to make a big difference. Liposuction is liposuction.
Correct. The outcome's about the same.
All right, then let's dive into the misconceptions.
Okay.
I would say the biggest misconception is that liposuction is a dieting tool.
So that's really important. So I want to just really be clear that liposuction is a body contouring procedure. It is not a weight loss procedure. So patients that are ideal candidates for liposuction are those that are at their ideal body weight, are within 5 to 10 pounds from that, and that have stubborn pockets of fat that are resistant to diet and exercise alone. Those are patients that are good candidates for liposuction.
And I feel like especially liposuction is beneficial for those like stubborn areas. For example, the axilla fat or the bra rolls or your love handles. Those are just areas that as a woman we deposit fat more often due to our hormones, and sometimes we can't really get rid of that with exercise or eating properly. So if that is your main areas of concern, you will see a lot of like benefits of the contour. But if your goal is to get skinny with liposuction, that usually does not go well because number one, liposuction is not permanent, right?
So with respect to longevity of your results, you do want to make sure you're maintaining a healthy diet, regular exercise for longevity.
Yes.
So if you have major fluctuations in your weight, so for example, if you gain a significant amount of weight, that the fat can come back not necessarily in areas that we treat, but sometimes unusual areas. I once had a patient that had liposuction years ago, gained 30 pounds after that, and then the fat started to come back in the upper back area, which she never had accumulation of fat previously. So you have to be very careful.
Yeah.
So you want to be at a stable weight. Also, the opposite, if you lose a lot of weight, then you have a lot of skin laxity you have to deal with. So that can potentially compromise your results.
And then, like, that makes sense because, I mean, if you gain weight, they have to go somewhere.
Correct.
If you took out fat from one area, it might not go as much to that area, but then it has to go somewhere. So it would go to, let's say, the back, like that one patient. It could also go to your arms, your upper body, your face, or like the most bizarre areas.
Yeah, that's true.
Yeah.
That's true.
So I feel like the biggest reason why we have all of these misconceptions are because patients don't have a realistic expectations for liposuction. So I think we should go over that, starting with the subcutaneous fat versus visceral fat.
Okay, yes, I think that's very important to talk about as well. So liposuction only removes subcutaneous fat. So subcutaneous fat is fat below the skin, above the fascia. It does nothing for visceral fat.
Yeah, and the visceral fats are the fat between, like, around the organs, underneath the fascia.
Yes.
And liposuction isn't going to do anything with that because we're not going to go that deep. And the only way to get rid of visceral fat is just to exercise and have a healthy diet.
Yeah, so as you mentioned, visceral fat is intra-abdominal fat. The only way to minimize that is through weight loss, through exercise and diet.
Yeah, and then I think most like morbidly obese patients or patients that are on the heavier side struggle with visceral fat. So even if they undergo liposuction procedure, it's not going to do much. They just have to rid the visceral fat.
Yeah, so it's a very important concept for them to understand the difference between visceral and subcutaneous fat. Visceral fat is a lot of obese patients struggle with visceral fat. So if they come in for liposuction, sometimes they don't notice a big difference after having the procedure because the problem is not the subcutaneous fat, it's the visceral fat. So that's one thing that has to be taken into consideration.
Yes. So another misconception. Sometimes patients think after liposuction, you're just going to look all sucked in, all tightened up, which is not necessarily true. So if you have underlying skin laxity issues before liposuction, the procedure could exacerbate it, right?
Correct. So that's another thing that's very important to talk about as well, is that if you have pre-existing skin laxity, liposuction can sometimes make that skin laxity worse. Now, there's a lot of factors to consider when you think about the amount of skin recoil you'll get. One has to do with age. Younger patients probably will have more recoil than older patients. Also, genetics plays a role. Now, if patients have very mild to modest skin laxity, sometimes adding a skin tightening procedure with liposuction will help.
Like Renuvion, right?
Correct. I love Renuvion. I like to use that. It works really well. But if you have severe skin laxity, the best thing to address that is doing a skin excision procedure.
And that is a factor that you go over during the evaluation.
Correct.
Right?
We talk about that during the evaluation.
So during the evaluation, you talk about the skin laxity. You also take a look at the diastasis, right?
Yeah, so even before the diastasis, I also like to point out what is subcutaneous fat. So what I'll do is I'll pinch the area in which the patient wants to be treated, and I point out that this, what's in between my two fingers, this is the subcutaneous fat layer. So this is what can be improved with liposuction. So that's the first thing I point out.
Okay.
Rexus diastasis. If a patient has that, I always like to make sure that they're aware of that. Some patients will come in with protuberance of their abdominal wall and think that that's all subcutaneous fat and that liposuction is going to help. So again, I have them pinch that area so they can see the subcutaneous fatty layer is thin, and that's related to abdominal diastasis or abdominal wall diastasis.
So basically anything that you could pinch.
Correct.
is what could be treated with liposuction.
And as you know, diastasis, the only way to correct
is
that
plication, which
is
is
through
through
surgery.
abdominoplasty.
Exactly.
Yes. And then we also put a big emphasis in screening for hernias, right?
Correct. So again, a part of the assessment, we want to examine the area, especially the abdominal wall, to make sure there's no defects, no hernias. Because if there is a hernia that's undetected or undiagnosed before surgery, there's higher risk of a really specific complication of intra-abdominal organ injury, in which we'll talk about that under the complication section.
And then let's see. I guess the next misconception would be that patients think we could do liposuction in every single area that has fat, which is not true because the structure of fat tissues differ in different areas, right?
That's correct. So there's actually areas that we like to avoid. Those are called zones of adherence.
Zones of adherence.
And it has to do with there's more fibrous tissue or connecting tissue between the underlying fascia and the overlying skin. To create more definition in certain areas, it helps to define, in a sense, the female anatomy versus male anatomy. So any violation of these areas puts the patient at increased risk for contour abnormalities. So we avoid these areas during liposuction.
So basically like the fascia layer and the skin is like adhered to each other, and that creates like a border.
And exactly. That's a good way to describe it.
Liposuction could potentially like disturb this layer, which leads to contour deformities.
Correct. That's a good way to say it.
So what is like an example area that you don't recommend liposuction?
So one of these areas is the posterior thigh. So that's one of the reasons why we try to avoid liposuction to the posterior thigh.
And I feel like posterior thigh is pretty interesting because we also have a lot of patients concerned about the cellulites on their posterior thighs and think that liposuction will get rid of it.
Yeah, so I'm glad you made that point, because liposuction will not improve cellulite. In a lot of cases, it can actually make cellulite worse. There is different modalities that can be used with liposuction to target cellulite, but I think that the results of those modalities very modest, to say the least.
Yeah, and unfortunately, cellulite is really difficult to target and treat.
Correct. Yes.
All right. The next misconception is when a patient comes in and asks you to get rid of every single ounce of their fat.
Okay.
But liposuction has limitations, right?
Absolutely. So if you're too aggressive with liposuction, you can actually increase risk of different complications. One being skin necrosis, right? Because you're violating the underlying vasculature. So there are limitations to liposuction.
And then I think it's always important to note that fat is not a bad thing. Fat is actually like an essential part of living, and without any ounce of fat, you probably won't survive. So I think it's always important that we need some fat, and liposuction isn't going to get rid of everything.
Yes.
So for aesthetic procedures, I think we set the limit as 5 liters of fat, right?
Yeah, so for outpatient liposuction for aesthetic purposes, our limit per session is 5 liters. Now, most people don't have 5 liters in any particular area.
Yeah, and then I feel like just saying 5 liters, you can't really gauge how much that is. But 5 liters is basically 10 of these bottles.
Okay, that's great. Yeah,
so that's a lot.
Yes.
And no one, usual people don't normally have this much fat, so you won't actually reach that 5 liter limit anyways.
Correct.
And then can you take out more than 5 liters of fat technically?
So in some cases, we can take out more than 5 liters of fat at one session. Those are usually for more pathologic conditions, one being lipedema. But in those cases, liposuction is done in a hospital setting. So patients are staying in the hospital overnight for monitoring. We call this large volume liposuction. The problem with large volume liposuction is it can create significant fluid shifts. So the patient,
that's why we want them to stay
to be monitored. Exactly. So it can cause dehydration or it can cause fluid retention. So that's one of the reasons why we have to monitor to the patients.
Oh, I've been hearing this around social media lately. Awake liposuction.
Yes.
So basically you're not under general anesthesia during liposuction, and you're kind of awake during the procedure. And I think you prefer that, right?
Correct. So awake liposuction is basically doing liposuction under local anesthesia. Now, the reason why that would be beneficial is that, of course, you don't have the risk and the complications associated with general anesthesia. So patients have a faster recovery. I prefer it because the patients are actually able to reposition themselves. So it allows me to target certain areas more efficiently, in a sense.
And you can kind of get into the nooks and crannies.
Exactly.
Okay.
And one of the reasons why we can do it awake is because we use a special solution that's called a wetting solution. So this solution is a combination of like a buffered saline with lidocaine and epinephrine. So lidocaine is the local anesthetic or the numbing component of the solution. So with this, we're actually able to put more lidocaine in the solution because it's slowly absorbed by the fat over time. And so that's why patients are able to be comfortable during this procedure while they're fully awake.
And I feel like any chance that you could avoid general anesthesia, it's always recommended just because it decreases the amount of risks associated with the surgery.
Absolutely.
And I think it might sound scary that you're awake during a surgical procedure, but thankfully, you're going to be given oral sedatives, so you're just going to feel kind of relaxed. And then the wetting solution makes it really comfortable. You won't really feel anything.
Correct. So we typically give patients some oral medications to relax them before we start. And they're completely comfortable during the procedure. They do really well.
All right. And then let's see. I think the last thing I want to emphasize is that people think liposuction is a one and done deal. But that's not true. Liposuction actually comes with a very lengthy and hefty post-operative management, right?
Yeah. So usually so some patients will come in and they expect that after liposuction that they'll have the results 2 weeks later. Well, that's unrealistic. So in most cases, it takes 6 to 12 months to get to your final results.
Any trauma to an area, it's going to take time to, number one, recover, number two, swelling to go down. So
so trauma can disrupt lymphatic, and that causes swelling, prolonged swelling. So that's another thing to take into consideration.
And then for the lymphatic, you recommend the manual lymphatic draining.
Yes, I do recommend that. I usually recommend patients to undergo 1 session each week for the first 4 weeks. That's important because it helps to clear lymphatic, so it minimizes swelling. So that's part of the post-operative management after liposuction.
In addition to the lymphatic massage, I know you put a big emphasis on scar massage as well.
Correct. So I think that is actually extremely important. It's probably one of the most important things to do after liposuction. So the reason why it's important, and I like to use this analogy to my patients, is that just imagine if you get a cut on your hand or a cut on your arm, your body will form scar tissue. Well, that initial scar tissue, it becomes thick, it's hard, and it adheres to the overlying skin. So if you try to move the skin over the scar, it doesn't move. Well, the same thing can happen with liposuction, right? So when that happens, that can actually pull down the skin and tether the skin in certain areas.
And that's how you get the dimpling.
Correct. It causes contour abnormalities. So the way to avoid this is by massaging the scar tissue every day. It helps soften the scar tissue and allows the overlying skin to remain supple. So it's important to do scar massage. I usually recommend patients do it once a day for the first 6 weeks.
Okay. And in addition to the scar massage, it is also very important to wear the compression garments, right?
Correct. So every plastic surgeon has different recommendations as far as how long to wear the compression garment. I usually advise patients to wear it for 6 months in total. So the first 3 months, pretty much wearing it around the clock. The last 3 months, wearing it 12 hours out the day. Now, the reason why wearing the compression garment is important is because it helps to minimize swelling, but it also helps to mold and shape the scar.
So it's kind of like the scar tissue acting like a glue between the subcutaneous tissue and the skin.
Correct.
So you have like a nice contour other than and you don't have the dimpling effect or contour irregularities, right?
Correct. So it helps to shape the tissues the way in a specific configuration or contour, and it allows the scar to set the tissues in that configuration. So that's how scar can be useful.
So scar could be good, could be bad. It just depends on how you manage the scar.
Correct. Exactly.
All right. Interesting. Now let's get into the complications, because I feel like complications are another thing that are often overlooked when it comes to liposuction. And it is true that liposuction is a relatively low risk procedure compared to other surgeries. Yet it is a surgery which comes with risks. So, I mean, you have the general risk associated with any surgery. Like you have the risk of infection. You also have risk of bleeding.
Yeah. So yeah, liposuction is fairly routine surgery associated with very minimal risk. But within the surgical procedure, there are risks. So most common for any surgical procedure, bleeding, infection, as you mentioned, in addition to hematoma formation, which is a blood collection underneath the skin, or seroma, which is a fluid collection underneath the skin.
Okay.
But that's risk of any surgical procedure.
So what are some specific complications for liposuction?
So paresthesias, so that basically what that means is sensation changes in the areas that we treated. So some patients may have hypersensitivity or hyposensitivity in those areas.
Are those permanent or?
In some cases, it can be permanent. In most cases, they do resolve, but it can take several months before they completely resolve.
Okay. And then they could also have hyperpigmentation, and that could be permanent.
Yeah. So that is one of the, again, it's a rare effect after liposuction, but it can happen that you can have permanent pigmentation changes.
And then there's also some toxicity related to the wetting solution.
Correct. So as mentioned before, the wetting solution has lidocaine in it as well as epinephrine. Lidocaine is the numbing solution, or the numbing part of it, the local anesthetic. Problem is that there is a maximum dose that we can give a patient, and that's weight-based.
Okay.
If we go over that dose, they can experience lidocaine toxicity.
And what does that lead to?
So it can lead, in severe circumstances, it can lead to cardiopulmonary collapse and even mortality. So it's very important that go with someone that's experienced, it's aware of how much lidocaine is safe to minimize any risk of these complications.
And that is the reason why we kind of recommend staging liposuction if you want to do multiple areas.
Correct.
Right?
So in some cases, if you want multiple areas to be done, especially if you're doing it awake, you want to limit the amount of lidocaine that the patient receives. So to do that, you can stage the procedures to minimize risk of lidocaine toxicity.
That makes sense. And then I guess like the biggest complication when it comes to liposuction would be the contour irregularities.
Correct.
And unfortunately, with that, the only way to resolve it is to go through a revision liposuction.
Correct.
Right?
So yes, for contour abnormalities, majority of them will require reoperation to correct. In some cases, it's just doing more liposuction to break down the scar tissue and to even out the contour. But in other cases, you may need to do fat grafting if there's severe depressions to add fat back to that area.
Okay. And then there's the liposuction nightmare. You guys probably have heard of it on like the internet, but organ perforation could happen, but is it common?
So it is very rare.
Okay.
Usually patients that are at higher risk are those that have undetected hernias or defects in the abdominal wall. But if it were to happen, it's a pretty serious complication requiring urgent operation and can lead to long-term morbidity. So very important to go to an experienced surgeon that really has experience with liposuction.
And that is also why we always check for hernias during the evaluation period.
Exactly.
Yes. And then I guess the biggest reason why we go over these misconceptions is because of my personal experience.
Oh, okay.
So I got I think I got liposuction done as soon as I turned 18, which was not the best idea. Number one, I didn't do any research. Number two, I had no idea what to expect for it.
Okay.
Number three, I just kind of went to a consultation and I was like, you know what, let's do it.
Oh, wow.
And then, am I happy with the results? Not really. And it's not because of liposuction, but it was more because I didn't know what to do. So, for example, my surgeon did not tell me the importance of the compression garment and the scar massage.
So, post-operative management.
So, I didn't do any of that. I didn't know.
Wow.
So, I ended up getting scar tissue formation on the medial thigh.
Okay.
So, if I look at my thigh right now, it's kind of asymmetrical and I see the dimpling effect.
Wow.
And the only way for me to fix it is to do more surgery, which isn't ideal. And I also experienced the sensation change.
Okay.
So for 6 months, my legs would my thighs would be numb every now and then. And of course, I didn't know that was like something that could happen. So I was freaking out. I thought I was like, oh my gosh, am I going to lose my leg? I was 18.
Wow. Okay.
Yeah. And then I
now,
guess
did that resolve with time?
it did resolve with time, thankfully. But I think it's just like added to my anxiety.
Yeah.
And all of that. And I think the biggest issue was that I was the person who got liposuction done to be skinny. So of course I didn't have a good dietary habit. I wasn't exercising regularly. So I mean, at first the fat cells were gone, but then they do come back, and they also came back in other areas. So I really had to make some lifestyle changes in order to like lose weight and become more healthy. So
that's why we're doing this podcast, to educate,
to make, number one, like, do your research.
Of course.
Number two, know what to expect when you do your surgery.
Yeah. Yes. Well, thank you for sharing your experience.
Of course. So, to wrap it up, Dr. Davis, what would you tell our audience that are considering liposuction?
Okay, so yes, so I think that, as you said before, it's very important to do your research. Do your research on what to expect, preparation for the procedure, what to expect during the procedure, as well as aftercare. Also, do your research on your doctor. Make sure it's a board-certified plastic surgeon that has ample experience with liposuction, so that these risks or these complications do not occur. So that's my last little tidbit on the subject.
All right. Well, thank you so much for staying with us for this podcast.
You're welcome.
As usual, if you have any comments or questions, you can leave it down below.
If you want to schedule a consultation, come and visit us in the heart of Beverly Hills. You can reach us on our website at GBDavis
Or you guys give us a call at 310-614-5898. And that's it for today, and we'll see you at the next podcast.
All right. Thank you for joining us. Bye.